everyone, I am Dr. Ravina, NHS doctor and Femtech founder of Zonas. Welcome to the dedicated channel for women's health. Today we'll be discussing the emergency contraception, also known as the morning after pill. So if you've just happened to stumble across this video, let me tell you this is one video of a series of videos on contraception. So if you're deciding which contraception to start, or if you want to change, please make sure you check out the other videos with lots of useful information. So let's start with talking about the emergency contraception. So let's imagine the situation. You're in a little bit of a predicament. You've had an episode of unprotected sexual intercourse. Perhaps it was last night, perhaps it was 2 nights ago, perhaps it was 3, or perhaps it was 5. Now, depending on when it happened, we have several options for you. It can be quite a daunting, lonely time, and it may be such a stigmatized topic that you may not have even discussed it with the people close to you, including the partner that you had sexual intercourse with. My advice would be to talk to someone as soon as possible. And it doesn't have to be someone you know, it doesn't even have to be your partner, and you don't need to necessarily even discuss it with your partner if you don't want to. You can discuss it with a healthcare professional, so not just your doctor, also a pharmacist or a sexual health nurse, and they'll have lots of information they can provide you with to help guide you on your decision on which emergency contraception to use. So the word emergency means that it needs to be done as soon as possible, because as soon as had unprotected sexual intercourse, the sperm has entered your body and there is a risk of your eggs being fertilized and therefore a potential pregnancy occurring. So we have a few options. There are 3 specifically. The first is a pill called ulipristal, also known as Ella-1. The second is Levonelle, and the third is the copper coil. And depending on what suits you is the one that we can go for. So with the first, ulipristal, that's a pill, and you can take it up to 5 days after unprotected sexual intercourse. So if perhaps you haven't gone to seek any medical help or any professional advice, and you've sort of dilly-dallied for a little bit of time, perhaps you're a bit nervous. Okay, so the way that ulipristal works is that you can take it 5 days after unprotected sexual intercourse, and then after you've taken it, we advise that you do start long-term contraception, so the combined pill or the progesterone only pill, and that can be started 5 days after you've taken the emergency contraception. And ideally, we'd like to give the emergency contraception as well as long-term contraception at the same time. Okay, so the next option is Levonelle, and this can be another very useful type of oral emergency contraception. So it's a pill and you can take it within 72 hours after unprotected sexual intercourse. It works by inhibiting ovulation, and we just like to be really clear about when your unprotected sexual intercourse was, purely because it has a smaller window, so only 3 days compared to ulipristal, which has 5 days. Now, a little bit of safety information. So if you have a weight of more than 70 kilograms, then we'd like you to have double the dose, so 3 milligrams rather than the standard 1.5 milligrams. If you are breastfeeding, this is fine for you to use whilst you're breastfeeding, so you can carry on just breastfeeding rather than taking any time away from breastfeeding. And also, as I mentioned before, we like you to carry on using contraception. So as soon as you've taken this pill, you're free to continue using contraception or start using contraception. So the combined pill or progesterone only pill, but obviously these pills will take a little bit of time to kick in before you get the full contraceptive protection from them. And the last method of contraception is, sorry, I'm really nasal and I can even hear it, but it's actually because I'm still recovering from COVID. I am actually COVID positive. I did a lateral flow test this morning and it was faint, but like not completely negative. So I'm just like taking my paracetamol. I've got my water bottle, which is, I keep having to have it because I keep coughing. But yeah, I thought I might as well produce some useful information for you guys whilst I'm stuck in my room in isolation. So that's why I'm all bunged up. So the final method of emergency contraception that we can offer is the copper coil. And the copper coil is a coil that we insert through the vagina into the neck of the womb, into the cervix, and it's really small. It's about half your finger. That's how long it is. Actually, some of them are even smaller than that. And we can insert that not only as emergency contraception, but also as long-term contraception. So you can keep that in for up to 5 years and then change it. The copper coil is about 99% effective, and it works by inhibiting fertilization. It makes the womb a really hostile environment, so the sperm just don't want to be there. They just run away. They just die because they do not like the environment at all. So that's how it stops fertilization from happening. The copper coil has quite an extended window of time in which you can use it. So the copper coil you can take either 5 days after sexual intercourse or 5 days after the earliest date of your ovulation date. So let me just explain that to you. If you have regular periods and you have a regular menstrual cycle, you may know what date your ovulation date is. So for example, if your menstrual cycle is around 28 days, then your ovulation would be on day 14. If you want to know a little bit more about the menstrual cycle and how your hormones work, I have got another video on this to explain when ovulation happens. So if you know when it happens, then you can have the copper coil inserted up to 5 days after the ovulation date. So whichever one is later is the one that you can go with. Okay, so let me just give you an example just so that it's a little bit more clear. If you were to have sexual intercourse, which was unprotected, on day 5, then you can either insert the copper coil up to day 10, which is 5 days after unprotected sexual intercourse, or if you know the earliest date of your ovulation is day 14, then you can take it up to day 19, which is 5 days after the earliest date of your ovulation date. So that just gives you a wider window for you to insert the copper coil, and just to give you a little bit more time in case you're just haven't got round to sorting out the issue yet. It is really important for you to do a pregnancy test around 2 to 3 weeks after you've got the copper coil inserted. So some safety information to do with the copper coil. So if you're allergic to copper, you can't use the copper coil. Sorry, we don't want any reactions. And also, if you're at risk of a sexually transmitted infection, then we would also need to screen you for an STI beforehand, before we insert the copper coil, because there is a risk of an ascending infection. So any bacteria, any infection that's culturing in the vagina, as soon as we insert the coil, we're going to take all that bacteria from the vagina and spread it upwards. So through the cervix, through the womb, which we do not want to do. So that's why we check you for an STI before the copper coil is inserted. And another thing we can do if we don't have the facilities or resources wherever you're getting your copper coil inserted to do an immediate STI check, then we'd give you prophylactic antibiotics. So that means we give you antibiotics just in case you have an STI. So just in case there's any risk of you having an infection, we give you the antibiotics alongside the copper coil, and that will kill any infection and reduce any risk of a infection spreading up from the vagina up into your pelvic organs. So things that may put you at high risk of an STI are things like if it's a one-night stand, if it's an irregular partner, if you don't know the partner, so you perhaps don't know if they've had many other partners who've been infected with an STI. So that's why it's a really good idea for any episodes of unprotected sexual intercourse with a new partner to do an STI screen. So these are really easy to do. You can get a kit from your local NHS service and they can post it to you, and you do the kit at home and then you can send it back to them, and it's all really confidential, discreet. You don't need to tell anyone about it. Alternatively, you can go to a sexual health clinic where they do internal swabs inside the neck of the womb and also in the vaginal wall, and that just looks for any bacteria or any viruses down below. So definitely recommend an STI check. And there we have it, lots of information on the 3 types of emergency contraception: ulipristal, Levonelle and copper coil. Let me know if you have any other questions, pop them in the comments below, and feel free to follow us at dr.ravina and at Zonas Fertility. Until next time, take care. Bye.